Hi, good morning, afternoon, and evening to everyone. Let me first thank Greg and the University of Manchester and the European Public Health Association for this invitation. I'm delighted to be talking to you today on the topic of cities as drivers of global health. And I am presenting from the New York City, the epicenter of the US coronavirus pandemic, but I do also, I'm really going to, I'm happy to take more questions about COVID-19, but I'm going to kind of allude to it in my presentation because I think one of the things that we see happening very much in New York is this sort of the very strong attention to the pandemic and to planning for not being flat-footed the next time it comes around is often obscuring many of the ongoing emergency situations and also shining a light on existing disparities and problems that we've known about for some time. So I'm going to try to weave that through my discussion. First of all, let me put urbanization in the, hold on, I'm having trouble moving this, just one second. Greg, I'm having trouble moving, there it goes. Okay, let me put urban health discussion in context. I sort of think of it as one of sort of four major public health challenges for the 21st century, along with these other items on the list. And let me just touch on each of these briefly before coming back to urbanization. First of all, the issue of non-communicable diseases and injuries. You can see from this slide that up at the top, the highest death rate is still caused globally caused by cancer, cardiovascular disease, and the public health victories actually of the declining mortality from acute infectious diseases like HIV, TB, and malaria, although much of that may be challenged now with the COVID challenges. But buried in that bottom group is the road traffic accidents, which are increasingly of importance and connected to the broader determinants of health. Aging, demographic shift is another of the major challenges of 21st century public health. This shows the trend data on percentages of the population over 60. And you can see while the world is sort of in the middle with the red line, and the more developed regions obviously have a much higher number of individuals over 60. The slope of low and middle income regions and countries is increasing slowly. So aging has become a global issue, not only an issue of the North. And then finally, climate change. This is a whole full conversation, but one of the characteristics of cities has been the heat island effect and sort of the notion of concentration of heat. But also on the climate change issues are the heat factor we know has been particularly troubling for vulnerable populations, older persons, younger persons, individuals who are not able to air condition or condition their internal environments in their residences. And also another area that's increasingly being looked at is the productivity of the workforce in very high temperature situations. So this is a real concern. And similarly, the fact that most cities are on bodies of water. So the issue of sea level rise is a huge issue for certainly for cities like mine, New York and others. So going back then to the issue of urbanization, the question is sort of, why have we started paying more attention to cities? The easy answer is that a few years ago, the exact year is still a little bit debated, but more than half the world's population began to live in cities, and this number is projected to increase dramatically over the next couple of decades. And I think the other factor here is that while historically urbanization had been seen as a high-income country issue or an issue of the North, it's now a global phenomenon. And you can see the slope and growth of urbanization in low and middle income countries. Now, another reason to look at cities, and the reason why I flag them as critical factors in achieving the Sustainable Development Goals and global health, is that while cities are extremely attractive, they are really the engines of the economy in most countries, responsible often for up to 70% of the GDP in a particular country. They're also centers of communication and culture and innovation. They also are responsible for over the majority of global energy consumption, greenhouse gas emissions, and global waste production. So the message here that is, without addressing these conditions in cities and leveraging the economic driver value that cities have, we really can't achieve global health goals. Now, cities have emerged, and there are networks of cities globally. These are examples of 3 of them. And many are finding it attractive to work with cities. Obviously, it was a big leap to go below the national level of government to deal with cities in the SDGs. But we have networks like the UN Compact of Mayors, C40, very well known for climate change leadership, and most recently air pollution, especially, and age-friendly cities, among others. So there are a number of networks, and mayors are increasingly responsive and visibly responsive to issues in which national leadership are really not able, for political reasons, or not willing for political reasons, to step forward. And people are focusing also for that reason as cities as change agents. Now, there are sort of 4 characteristics of cities that are used by many who do research on urban health: density, diversity, complexity, and inequities. And I'm going to touch on each of these. I think the message I want to leave you with is that urban environments and cities are neither bad or good. It all depends on the quality of management and the quality of governance to try to maximize the positive effects of these factors and minimize the negative ones. This is a chart of the sort of greater metropolitan areas to address the issue of density. This is an issue that's gotten huge attention, appropriately so, in the current COVID-19 epidemic, but you can see just the massive growth in greater metropolitan areas over the last 15 years or so. Diversity is another characteristic of cities. This is a borough in New York City, which was very much in the press recently, Elmhurst Hospital being the hospital that serves Queens along with another public hospital. But you see here the challenge for public services with the very large number of languages spoken, subgroups, and others, meaning that one really has to tailor and localize messaging for public health and engage with communities to engage them in working with you. And on the other hand, this is exactly the kind of characteristic of cities that makes them attractive to people who choose to live there. Complexity is another feature of cities. This is the organizational chart of the city of New York. I'm not going to go through it, nor will there be a test after, but the big message here, and I think this is true for most large cities, is the organizational structures tend to be quite vertical. This means that agencies of government have mandates, they have multiple programs and responsibilities, and we really need political leadership to bring these multiple actors within government together to tackle and develop shared goals, and similarly to engage with the private sector and with civil society organizations, as was discussed a moment ago. And then the final characteristic, which is really baked into urban health considerations, we don't have to remind ourselves, we live with this all the time. And I think this is an image from New York. If you look at the 2 age clusters in the middle, from 76 years to 85 years, that's 3 subway stops on the city of New York between East Harlem and the Upper East Side of Manhattan. And it really does underline the reality that very often your zip code may have more influence on your life expectancy than your DNA. So one of the challenges in talking about urban health is really introducing the concept of how health improvement is produced. In my experience talking about urban health, especially to global audiences, is very often when people hear the word health, they think about healthcare, personal health care, and they either stop listening or they expect you to start talking about hospital capacity, or primary care, all of which are important topics, but aren't necessarily the only, and certainly in many countries, the only factor in achieving health. This is a pretty iconic diagram. It shows you how long we've had the sense of how health improvement is produced. But recently, we've begun to develop an evidence base to verify the fact that while individuals are born with certain characteristics, their family environment, the conditions in their community, and then in the city or nationally, the health policies that shape communities are all important and need to be addressed to make change. And so this is a diagram that we've been using in the International Society for Urban Health to point to the fact that there are multiple sectors that help make cities healthier, and that decisions are made every day in each of these sectors that can either be health promoting decisions or decisions that undermine health. Transportation is one of the most visible, in the sense that decisions to invest transportation dollars in mass transit and active transport, such as bike lanes and walking, or sidewalks even in some cities, is quite different on the health impact on issues like obesity and mental health, really, in terms of being outdoors, walking, and taking advantage of environments, and the issue of cars, more cars, air pollution, road traffic accidents, etc. So these decisions are important, and similar ones are made all the time in design of built environment and urban planning, housing design, education, etc. And then just to focus on the governance bubble at the bottom, which is to reiterate the importance of political leadership and good governance, meaning government with other partners, to make the positive choices, the choices that are most often taken. The health in all policies approach has been around for a long time in global health, thanks to our colleagues in Finland who wrote, I think, the first book in the 30s. And I think we're beginning to understand how important this is as a conceptual framework for achieving urban health in those multiple sectors. The idea of the health and well-being of citizens is critical to any country's social and economic development. If one only thinks of health as healthcare, it becomes only, in a sense, a cost center for a country. And increasingly, this has been recognized. Again, all policies that can have an impact on determinants of health, and very importantly, the next bullet, the impacts of determinants are not equally distributed. So the issue of equity and health disparities really has to be addressed, along with the questions of partnership. SDGs, we've seen this picture a lot recently. The ones that relate to urban health are SDG 3 and 11. Using the framework of multiple determinants of health and using the notion of health in all policies, this is goal 11 for cities. And this is a goal that is being largely taken up by UN Habitat in partnership with WHO. But if we think about the multiple determinants, you can see on this list of variables in inclusive, safe, resilient, and sustainable cities, we see housing, transportation, air quality, green space, etc. And yet in this goal, it's very hard to find the word health. And happily, the UN Habitat has been developing the New Urban Agenda, and the UN Secretary General has taken forward a single UN to develop thinking about urbanization, the process of urbanization. And over the last several years, WHO and UN Habitat have been collaborating in very important ways to look at issues of housing and air quality, and are planning to put a casebook out shortly, which may be impeded a bit by our coronavirus shutdown, but I think it's really trying to help us think about how goal 3 and 11 can come together. This is a big shift, looking at broader determinants of health from the traditional, I would say, medical model for disease prevention. My career has mostly been in the clinical space, and I think a lot of the traditional interventions around goal 3, SDG 3, MDG 3 especially, have been on health system strengthening workforce and essential medicines. One might now add universal coverage as a major concern, but increasingly as the evidence base has been developed for addressing these broader cross-sectoral health and all policies kind of domains, we begin to see the importance of urban planning, of elements of the built environment and natural environment, as well as socioeconomic variables. And the key really is getting these two very large communities or multiple communities really to collaborate and interact. And again, political leadership becomes important, and the clinical community, which has tended to dominate the conversation historically in the health sector, I think increasingly is realizing that they may see a patient in a hospital or in an office, but if they send that patient out to the environment in which they came from, they may not get better. Their asthma may be exacerbated by the living conditions in their homes or the presence of a waste transfer station in their community. So this is a conversation that we're trying to promote in the International Society for Urban Health globally, and I think increasingly at country and city level. So bringing the SDGs and the new urban agenda together to call attention to urban health. Again, the role of health as both an input and an outcome of development is possible. One can think about that when you move away purely from concern about healthcare. The fact that healthy people are critical to a thriving country and city, that decisions are made, as I've said before, across multiple sectors that can influence the conditions in communities that create health, that equity has to be front of mind, and that the political environment and political leadership is a crucial issue. And finally, as we move through the implementation of the SDGs, there is a focus on national urban plans that are reviewed in many of the high-level reviews, that countries are encouraged to develop national urban policies. This obviously the key of decentralization strategies. Every country delegates more or less authority to local governments. And these are factors and abilities to have cities be more of an engine, more of a driver for global health. Governance is an important issue. Government, effective government, working with other partners in business and in the civil society, and looking at the healthy choices in large infrastructure investments. And finally, just a place-based strategy for all of our thinking about health and health improvement. So I'll stop there. Thanks, Greg. This is how to contact us, and we're delighted to talk to anyone outside and after this session.
Excellent. So we've got a few questions for you. So there's one that actually feeds in from the previous one. I think it might be the same person. And they would like to ask how, again, blind, deaf, partially sighted and disabled people are truly being engaged in ensuring healthy cities, particularly around accessibility and mobility issues.
Yeah, it's very interesting because I think in many ways in the United States, at least, the Americans for Disabilities Act has led the way in terms of certainly modifying built environments for this, for really all people. And I think the age-friendly cities model has also built on that platform. When Mayor Bloomberg was leading a lot of the public health change in the city of New York, the platform really was for cities of all ages, and many of our insights from addressing individuals with disabilities really had already created a platform on which to build broader health and all attention to changes, especially in the built environment and the socioeconomic environment.
And we've also got another question about green and blue spaces. So how important is the provision of green and blue spaces within city environments to ensure the health of the inhabitants?
Well, I think we're learning increasingly that green space is a really important factor, not only in people being willing to go out and exercise, but in mental health. And colleagues in Germany and others have really been looking quite directly at the mental health effects of a feeling of control over one's environment, of being able to move outside. And I think one of the reasons why, certainly in this city and many cities, people are being encouraged to exercise. I know in New York City, we're closing 40 miles of streets over the next weekends, the mayor's moving in that direction until the lockdown is over, to provide an opportunity for people to move around, to walk in parks, to with social distancing, of course, at this time, to run along rivers. And there's been a lot of development there. So I think that evidence is very clear on many levels and being really encouraged.
Great. And we've got one final question before we go on to Stefano's presentation. How do you overcome the challenge of the urban poor living near to the urban rich with shared policies? Do you feel that policymakers address this issue enough?
The answer is no, they don't. I think that's been very clear, certainly in the impact of COVID-19 in the United States, and I think globally. The mayor of New York, Mayor de Blasio, has actually done something I think very important from a policy point of view by asking the health department and all the agencies to look at the equity factor in developing indices and developing programs. So for example, New York has indices of distance from parks, the issue of air pollution, looking at relative air pollution rates in different geographic areas, issuing very explicit reports on communities within the boroughs and the distinction between communities like East Harlem or Bed-Stuy and Brooklyn and other entities. So I think this is it's a concern. Obviously, the overall investment is slowly beginning to align, but there's much more work to do. And I think one of the concerns is while the COVID-19 has shown a very distinct light on these disparities, the challenge is in the pressures. Can one maintain a focus on improving equity in the recovery phase and in a way that's sustainable going forward to try to close that gap that was identified by the question?